Good evening, ladies and gentlemen, and welcome to the MedHyve community event at the Collaborate track of Philippine Startup Week 2021. We are talking about startups involved in healthcare, and we're really asking the question, can you build a business on care? Find out how healthcare startups respond to COVID 19. And so, to start off this session, I'd like to bring in the CTO and co founder of MedHyve, Mr. Gabriel Lopez, who will be talking to us on how MedHyve has responded and impacted the hospitals the past year. By the way, MedHyve won the Philippine Startup Week competition last year. We practically dominated the event because we had two championship titles, one from Arise and one from Seed Stars. We represented the country in the startup competition, which was global. So, Gab, welcome and talk to us about MedHyve.
Hi, El. Thank you for the kind introduction. So, as mentioned earlier, I'm Gab, CTO and co-founder of MedHyve. You may recognize me from last year when we dominated the Philippine Startup Week with our two wins from the Arise Startup Challenge and the Seed Stars Manila local competition, where we represented the Philippines in the regional Asia stage. And now I have the opportunity to share how we at MedHyve built a business on care and how you can solve great problems that matter. So there are many ways to understand a community's pain points, but by far, experiencing it yourself is the best. And on our end, we're lucky we had Nigel for that, our CEO and co-founder. He owned two hospitals and he completely understands the inefficiencies of medical procurement because he and his family have been facing them for decades. And it helped us understand how a problem like this can affect millions of Filipinos and how it could prevent them from getting access to healthcare. And we were looking for the best ways to approach it. But in reality, there were so many problems and we didn't know where to start. And that's really where we learned a valuable lesson in triaging. See, in medicine, a medical practitioner often has to respond to patients with different levels of urgency. Some may need emergency treatment, some are on priority, which have a bit more time but still require treatment as soon as possible, and some are non urgent, which are in no immediate danger. So we spent a good amount of time in the beginning working towards categorizing these problems, figuring out which problems were emergency problems and how we could effectively solve them. To do this properly, we had to visit different hospitals across the country to figure out their most urgent concerns. And we found that there were three main problems that the many hospitals faced. First was that they lacked access to quality medical suppliers, and they were often victim to fraudulent transactions and scams. And their logistics and payment limitations led to difficulties with the suppliers reaching most hospitals. All these made procurement difficult, especially for far-flung hospitals across the Philippines. And these are really the reasons why we built MedHyve. And our goal with MedHyve was to make medical procurement easy and simple for hospitals nationwide. We built a platform that connects hospitals to a digital network of top distributors and brands across the Philippines. And we built a robust KYC process to ensure that each hospital is transacting with trusted suppliers and, and distributors. And with our partners in logistics and payment collection, we're able to extend the reach of these hospitals and help them easily purchase some suppliers across the Philippines. With this, we were able to play a big role in distributing medical supplies during events like the Taal volcano explosion, the pandemic, and of course during the various typhoons over the past 2 years. And because of this, we were even able to get praise from Lenny Robredo, who has mentioned that our use of AI technology is making procurement faster, more transparent, and cost effective for hospitals and clinics. And we were even able to get the trust of top medical brands worldwide like Johnson& Johnson, Omron, and Diversey. But we didn't want to stop there. See, being able to build a business on care means a continuous triage. You have to constantly speak to users to find their problems, to find the best way to tackle them. The first step was the medical marketplace, but we wanted to solve their deepest problems because we identified there were a bunch of different problems. We just solved the most urgent ones. Another problem we saw was the fact that doctors and medical practitioners were being pushed to handle the medical procurement of the hospital. And of course, they lacked the business expertise needed to have a proper medical procurement process. Because these people, are doctors. They went to med school. They didn't take MBAs. They didn't want to have to think about these things. That's really why we built MedHyve Intelligence. With MedHyve Intelligence, we're giving doctors an AA dashboard that allows them to forecast demand, to let them know when to buy and how much. We help them recommend the best suppliers depending on the hospital's demographic, including their size and location. And we help them recognize patterns in their fluctuating procurement needs. On the supplier end, the problem goes the other way. They needed to make more data-driven decisions, but lacked the proper data to be able to do so. So we help them track their sales across their nationwide network of distributors. And our AI dashboard helps them predict product demand in different areas and times. And we give suppliers a view on which cities or regions buy the most products. And all of this comes together to help them make data-driven marketing and sales decisions in order to generate the most business value with the least cost. And all these are coming in 2022, and we're happy to say that we've been funded by the DOST PCHRD to help develop MedHyve Intelligence. So what I'm trying to say here is really, as you build a business on care, you start to know that you gather a group of staunch supporters who would help make sure you succeed on your vision. You need to be able to find that group, because once you do, you know that you're really creating a solution that impacts the end users. Because as you support others, the world finds a way for you to get support back. So to build a business on care, you have to build deep empathy with your customers. You have to be ready to fight tooth and nail to make their lives better. We built MedHyve to be able to give hospitals and clinics access to affordable medical supplies, because we know that translates to better access to healthcare overall to patients all over the country. To build a business on care, you have to be able to empathize. You have to be able to understand their problems. You have to be able to build solutions that tackle directly those problems as quickly as possible. Because for these people, these problems could be an emergency. They could be one of their biggest priorities. And you have to be able to ensure that you're building in the best solution that can solve the problems as quickly as possible. So MedHyve is the future of medical procurement. And to show what we've been doing for hospitals across the country, we have a short video here afterwards. Thank you.
They're fighting a war here and they're losing. The sheer numbers of people succumbing to the coronavirus is overwhelming every hospital in northern Italy. The staff are working flat out trying to...
I'm Nigel Lirio, co-founder and CEO of MedHyve. Over the past 50 years of my family managing our hospitals, I saw firsthand the struggles of hospitals and clinics trying to find medical supplies. Over the past decades, we've seen the most procurement processes have remained unchanged. And in the last year, we saw just how ineffective these processes hold up to a crisis. Right now with the pandemic, hospitals and clinics are struggling to efficiently find and procure the medical supplies needed to deal with this crisis. This is especially true for institutions outside Metro Manila. Based on our research, provincial hospitals spend about 50% more on average per SKU as compared to hospitals in Metro Manila. My family founded 2 private hospitals, and growing up with these hospitals, I learned more and more about how it worked, from its top-level operations down to its fine mechanisms. As an aspiring computer engineer, I started asking, is there a better way to do all these things? Fortunately, my co-founders and I had the privilege of meeting Dr. Rustico Jimenez, where we aligned on the vision of a digitally empowered hospital and disrupting the antiquated processes in medical procurement. As we've seen throughout the pandemic, the future of many industries is with technology and innovation. Grab changed the way we look at transportation, Foodpanda's changed the way we look at food delivery, Lazada's changed the way we look at shopping. In just a couple of years, we've seen how technology has drastically changed our day-to-day lives. In the healthcare industry, technology will also positively disrupt the way we do things. Our mission here in MedHyve is to deliver this future to the Philippine healthcare industry. As hospital administrators and doctors, you're already swamped with problems to solve and patients to manage. Your focus should be on treating patients, not on purchasing medical supplies or equipment.
With this platform MedHyve created, they created an ecosystem for users to be engaged regularly to support initiatives that leverage technology to improve quality services and improve quality care. The objective of this platform is really for accessibility of doctors, clinics, hospitals to obtain medical supplies which are essential. And of course, the advantages are it's safe, faster, convenient, specialized through our principals and distributors like the Ethicon and Patient Care, thus really adding value through partnerships.
Don't you wonder how your procurement process can be made faster, more efficient, and cost-effective? That's why we created MedHyve. MedHyve is our digital procurement partner, and we empower medical institutions by giving the tools to build robust and efficient procurement process, whether you're a hospital in the city or a clinic in the province. We make it easy for you to search across the largest catalog of medical products in the Philippines and give you the tools to simplify each stage of the process, from canvassing, quotations, payment, and even issuing POs. All digital and all on MedHyve. We're happy to announce that the DOST PCHRD has directly funded us to build the future of medical procurement, MedHyve Intelligence. With MedHyve Intelligence, we take the guesswork out of procurement by giving you an AI assistant to help with everything from inventory forecasting, identifying price fluctuations, and predicting medical supply trends. Over the last year, we've partnered with international medical industry giants like Johnson & Johnson, Omron, Diversey, and over 100 other brand and distributors. We've also won awards from some of the biggest international startup competitions, who all recognize that we're changing the future of the medical industry. Top leaders have put their confidence in MedHyve, including the president of J&J Philippines, Raghu Krishnan.
Allow me to congratulate and say a big thank you to our partners, MedHyve and Patient Care Corporation, for giving J&J an opportunity to be a part of this incredibly exciting initiative. It's the first time our medical supplies are having access to e-commerce channel. Through this collaboration, we are able to improve access to quality medical supplies for our doctors and small and medium-sized hospitals.
And even the Vice President of the Philippines, Lenny Robredo.
All hands on deck. We need more of us who will find ways to uplift the lives of our fellow Filipinos. More of us to rise to the moment, and more of us to widen the path for others to follow. Know that I and the rest of our team here at the OVP are standing with you. I wish you all the best, MedHyve. Make us proud.
MedHyve is building the future of medical procurement, and we'd love to invite you to join us.
We are MedHyve, an online market space of medical supplies. Our platform connects your business to our ecosystem of suppliers. Here, we provide you with all the tools you need to search, canvass, and purchase medical products for your business. Our market space not only allows you to browse an extensive list of products, but also allows you to notify suppliers of your product needs. Finding the right product is easy with our in-depth search function. Filter products by price per quantity, rating, and other factors to help you handpick the right products. Furthermore, we make comparing similar products easier with our smart canvassing feature, which presents the products with all the information you need for picking the best one. With MedHyve, you can choose our e-bidding system to post your product requests, which you can choose to open to suppliers of your choice or to all. Unit price is automatically scaled with your order's volume, giving you the best price possible. Purchasing your products on the MedHyve is easy and secure. We'll have a plethora of payment options available for your convenience. Procurement doesn't have to be hard. Pioneer the new world and join MedHyve today.
You've just seen our corporate video, and now I am joined by a certified frontliner. He may not be a practicing doctor or nurse, but he is a hospital administrator who stands alongside our healthcare workers, especially in these challenging times. So, hello and good evening, and welcome to the Philippine Startup Week community event by MedHyve. Mr. Richie Lirio, the COO of the Gupan Doctors Villaflor Memorial Hospital. Hi, Richie.
Hi, El. Good evening. Good evening to you. First of all, congratulations to MedHyve and the Philippine Startup for this very successful activity. And
Yes,
I'm ready to answer your questions.
thank you so much, and thank you for joining us. I know you're very busy, but I think there are several items that we need to talk about so that our audience would find out how startups like MedHyve really support the medical community. So, you know, our audience have known how difficult it is to live through a pandemic. So let me start by asking you, how was it like for a hospital during the pandemic?
Okay, El, where to start?
It
Everything
must
has
have been very
changed.
difficult, right?
Yes, it could be considered as a medical issue, but actually the effects are far-reaching and it cuts across all the industries. So we were experiencing economic recession. We now have the work-at-home arrangements. Of course, school activities have been delayed or compromised. In general, a lot of effect on society in terms of travel, tourism, so all of
Mhm.
that. Now, as to healthcare, uh, well, one effect that we've noticed is on mental health and health behavior.
Oh,
Um,
wow.
Now people are more conscious about health, but for us in the industry, we have been more sensitized with infection control. So those are things that are now in the forefront, and because of that, we had to, I guess, adapt to it and came up with novel ideas on how to ensure that we do not spread the COVID virus as we provide the service, and at the same time prepare ourselves, protect ourselves from the risk of this. So we've had where we now see telehealth and telemedicine
Mm,
that's in the forefront. Uh, just a rewind back to a few years ago, we wouldn't think about telehealth or telemedicine
that's true.
because I don't know, there's something off with it. Doctors probably prefer to see the patient more. We're
Hmm.
a country that loves TLC or tender loving care,
Right.
and
The human
this
touch.
is something that you cannot find in an online consult.
Hmm.
But now we have to adjust to that, and that's one thing that we have to embrace. Then, of course, technological innovations. So basically, it's we're trying to be to rely more on online services and a lot of things that have to be done online just to prevent this spread of the virus.
Hmm. So technology did support you, I suppose, during the beginning of the pandemic. But as a hospital leader, Richie, what was your role in responding to, the changes? So there's a pandemic happening, technology is being rolled out. What was your role in this?
Okay, so I have to confess that we had the administration had to take a back seat on this. Uh, this is a medical problem, and we had to have the medical team take the lead. They would know more. I don't know. I'm not a doctor, so
Hmm.
I would have to rely on what they think is best for the organization and for the patients. And we were lucky that our medical team took the challenge of learning what it was. Everybody doesn't know what COVID was when we
Right.
started. So
Hmm.
this is something new. They haven't seen this, at least not in this lifetime, and that means they also had to learn a lot and then try out a lot of things to make sure that we are going in the right direction.
Hmm.
So all their suggestions on infection control, on how we should treat patients, what we should have resources for, were driven by our frontliners and our doctors.
The
And
medical team.
admin's role is mainly to provide that support and make sure that whatever resources they need are available for them to do their jobs.
That's very interesting. I think this point is actually very new to me, and I've been moving in the healthcare sector for quite a while. But to understand that during a very big change, that we also need to be mindful on who we should be listening to. I think that's one important thing because, as you said, this is something new. We haven't seen this in our lifetime, and we try to deal with it with what we can. Now, for hospitals, I know that patient experience is very important. So, with all the challenges that you just mentioned, how was hospital? How has it responded in terms of patient experience in a pandemic situation?
That's a very good point, El. It was very challenging. Uh, the metrics that we used for patient experience was rendered almost obsolete because uh, note that
Obsolete. Very good word.
note that a lot of patient experience dealt with having a face-to-face conversation with a patient. There's a
Mm-hmm.
lot of touch. Actually, us Filipinos are known for that.
Mm-hmm.
As I mentioned, tender loving care. But now comes this pandemic,
Mm-hmm.
and now we have to maintain physical distancing.
Yep.
So we had to do a lot of things online. Uh, we did patient scheduling. Again, another thing that our country has not embraced so far, patient scheduling. The usual practice, I would say about 95 to 98% of things done in the hospital are on a first come first serve. So you just go to the hospital and line up. That's
Mm-hmm.
basically what we used to have. But now there is this necessity for patient scheduling
Right.
because you don't want to crowd people, so you will have to schedule them. We had to introduce a triage system. Again, something that we were not doing before. And the thing is, all of these measures were very inconvenient for a patient. Lining up for a triage just to be interviewed, have your temperatures checked, you have to fill out forms. all of that is very inconvenient for a patient who never did that prior to the pandemic. And then, of course, wearing of masks was also something that affected patient experience because you can't see your frontliner smile. So all of this would affect how we measure our patient experience. So actually, I'm trying to find ways on what kind of metrics should we
Mm-hmm.
use now, given that this is now the situation that we're in. So
Right.
very
Uh,
challenging.
Very interesting as well because so I'm joining you from Singapore, and so I had the privilege of seeing an advanced healthcare system and the Philippines that is on its way, on its way to being upgraded. And you did mention that for patients, because it's something new, they were inconvenienced. It's not something that they immediately embraced. I think this is a very good takeaway, since we are at the Philippine Startup Week, and really startups are trying to introduce novel and innovative ways into different industries. So this is probably one of the points that we need to highlight. When you introduce something new, it's not going to be, but it has to happen because, as you said, some of the old things are really obsolete now. It's a new world. They call it, right? It's a new normal. And so startups play a very big role because the energy to drive this change usually comes from, well, smaller players that eventually will be major, presence in industries like healthcare. Now let's talk about procurement, because I can imagine this is still an ongoing challenge. We read in the news at the beginning of the pandemic that it was really difficult to find PPEs for our frontliners. But what was your experience like in your hospital?
Okay, like any other hospital, we went through all of the different stages in terms of procuring items essential to battling the COVID pandemic. Uh, I recall when we started, it was a mad scramble for PPE because you had to make sure that you're protected. We didn't have a very clear picture yet as to how it is transmitted, what practices you need to maintain so that you don't get infected. So the knee jerk reaction would probably be just to cover yourself with a lot of things. So PPE was one of them that became a quick challenge because of the shortage. Uh, but that progressed on to the different things. After, I guess, adjusting to that situation, then you had to scramble for testing supplies. Uh, you try to find a way. We've been through a different tests. We did antibody, then we went to antigen, and then now PCR testing, and all of those were not readily available on the get from the get go. And the thing is, where to source them is actually an issue for a country that's developing. Everybody, this is a global pandemic, so all countries are looking for all of these items, and it's very difficult. So now we're at the back part of, hopefully it's towards the end of the tunnel. We're now looking for vaccines. So
Mhm.
how many doses or jabs that we need to reach herd immunity. Uh,
Right.
it has been postponed for our country. We initially had a target of a modest 70% coverage by
Mhm.
end of this year, but that even has been pushed back further to probably the first half of 2022 because, well, one is the shortage, but mainly it's a shortage. But there are also other factors that come into play to make it difficult for
Mm-hmm.
our country and our healthcare facilities to have those very important resources to be given to our patients. So that is one issue in shortage.
Mm-hmm.
But the pandemic also limited mobility. So in that case, our purchasing staff who could have been very aggressive in
Mm-hmm.
pursuing for materials by going looking for it, going to Manila, which is the center. We are in a province where it's about 3 hours north of Manila. So we have to some of the items that we need to buy come from Manila, and
Mm-hmm.
because of these restrictions, the quarantines and all that, it's very difficult to move. And
Right.
if I notice, even the pharmaceutical companies with their medical representatives
Yes.
also had difficulty because hospitals would not accommodate them in their hospitals because they know that these individuals move around several hospitals, and they of course fear that these individuals will bring the virus with them when they visit the doctors in our hospital. So that also, well, hopefully there's an online app that comes out for that, uh, between the
We're
doctor
working on
and
it.
the
MedHyve is working on it.
that's good. The doctor and the medical representative to at least update each other. So those are that at top of the mind are my issues of procurement during these trying times.
Right. So thank you for sharing that because for ordinary people who are not in the industry, they probably will just stop at PPEs because um, it was in the news before. But we didn't realize that the procurement of medical supplies for hospitals like you who provide healthcare to patients like us is even more complex. So it goes up all the way to testing, to pharma drugs for
Mhm.
treatment and vaccines. So you've always been one of the early believers of technology innovation in healthcare, and that's why we appreciate the support that you've given to MedHive. So earlier, before our session, my CTO Gab has just presented on what MedHive is, but just to give the audience an idea of what we do as a startup, we are a digital B2B medical supplies marketplace. We leverage on technology. So um, this is really the problem that MedHive was trying to solve and continuously um, wants to solve. We want hospitals, clinics, healthcare providers to be able to access quality, timely medical supplies. Because in the end, if these medical supplies are not available to our healthcare providers, patients like us suffer. And that's everyone watching this session. And so at last year's Philippine Startup Week, MedHive won the champion titles for both Arise and
Congratulations.
BeatStars. Yes, so it's been a year since MedHive was recognized in the same event. And now we're here, we're bringing in industry leaders like yourself later. I'm going to be talking to a panel of other medical and healthcare startups. Now, can you share, based on your experience as a hospital administrator, how MedHyve, a Philippine startup, helped you in providing quality healthcare to your patients and other stakeholders?
That's a very good point, El. First of all, congratulations for for winning last year, and I know your journey has been a very fruitful one. Um, like other online services that are available, we have other platforms that you can buy a lot of things. So the business model of MedHive is truly not really that unique because there are others, but MedHive is more focused on hospitals, medical supplies that are needed by these hospitals. Buying online is a good alternative, but here is the thing that we noticed. You have to be worry about the quality that you get from the different sites I know it's easy to buy from any online site, but there are also horror stories that come along with it uh, when you buy something. And the thing is, these are very critical supplies that you
Right.
use for your patients. So if
Lives are at
you
stake,
lives
right?
are at stake, and if you buy something that's not
Mm-hmm.
of good quality, then you will also have more problems than solutions. So for MedHyve, the experience that we've had with MedHyve, they were able to provide the needed supplies of good quality and at a lower price. We didn't stick exclusively to online purchase because we also had contacts, the usual garden variety way of buying. But the thing is, we noticed that we were able to procure items at even a lower price, despite the quality is still good. You still can get it at a lower price. It also was supplied to us in a timely manner. So timeliness is also of importance. It just doesn't uh, rely on having the quality product, but you need to have that quality product at the time that you need it because your patients' lives are at stake. So timeliness is very important. And of course, the affordability part is crucial as well because what I don't know if we noticed this, but it is now costly to to obtain medical services because of a lot of things that have to be added on, a lot of supplies, items that need to be added onto that service delivery. That would make both the parties, the provider and the patient, safe from this the management of the particular case. So we also tried to make it as cheap as possible because we know that these are trying times. In all industries are affected, and the buying power would be very limited for those uh, everyone who gets sick. So
Mm-hmm.
basically, affordability is also one issue, and we're very happy that Medai was able to provide these services and supplies to us at a cheaper rate. Remember that we didn't have to waste gas and people time
Yes.
to go around and move around, and that we can factor in the pricing of our services and supplies.
Right, right. So thank you for sharing that. So I guess this, the last statement you mentioned is really just it answers the theme of this session, which is how can startups respond to COVID-19, and who the best to give an example about other than you, hospitals, right, who provide healthcare. So, Richie, I'd like to chat some more, but we are pressed for time. So can you just give your final message, probably a lesson that you learned from the pandemic as a hospital administrator, as someone who deals daily with our frontliners. um, Go and speak to our audience and inspire them.
Okay, so I think if I would have something on the top of my mind to share to you about lessons, is maybe learn as much as you can, be open minded and flexible, be ready to pivot to other services or other service delivery uh, points that you can offer to your clients because this is something different. We haven't seen this yet,
Mhm.
and definitely we will need to have that addressed. And for you startups, I think you have to look at the pain points of the different clients and service providers, and from there you can build up services that will be useful for these players, so that everybody it's going to be a win-win solution for everybody. So that's basically my short
Thank you so
message.
much. Thank you, Richie. You just heard from Mr. Richard Lirio, the Chief Operating Officer of the Gupan Doctors Villaflor Memorial Hospital. Up next, we are going to hear from a panel of startups in the healthcare space. It's going to be another exciting discussion as I'm joined by MedProjects, Zenia Health, Dash Labs, and MedHyve CEO on our next session. And we are talking about startup led initiatives in the healthcare sector in the midst of a pandemic. Can we really build a business on care? So let's hear from four healthcare startups responding to COVID 19. So we will bring in on our virtual stage our panelists. Let me start with my CEO and co founder, Mr. Nigel Lirio, who is with me at MedHyve. We're also joined today by Dr. Kevin Dineros, Vice President for Medical of Zenia. And we're also here with Brian Geiger, CEO and co founder of Dash Labs. And last but not the least is Dr. Mike Muin, CEO of Med Projects. Good evening, gentlemen. How's everything going?
Good evening, Al.
Good evening.
Good evening.
Good evening,
Right.
Al. We're doing well.
Wonderful. So I'm excited. I am the rose among these bunch of thorns, but I'm going to make sure that the audience understands that we are all roses in this industry. But so we're talking about startup-led initiatives in the healthcare sector, and we're trying to find out, is it really worth building a business on care? Because here at the Philippine Startup Week, it's covering a lot of industries, many different verticals and sectors, but we're talking about healthcare now. So can we just start by probably asking everyone on what was your background? How did you get involved in healthcare? So I have two medical doctors on this panel. So let's start with you because I think the connection is quite obvious. So, um, Dr. Kevin.
Sure, that's a good question to start with. So, healthcare has been in my family's DNA. So, my father was a doctor, he's a surgeon, and most of my relatives are actually in the healthcare field as well. But me being involved more in I guess, the digital health sphere, I guess that was an awakening for me when I was in med school, when I realized that a lot of processes in the hospitals are very redundant and repetitive, and there must be a better way of doing things. So from then on, I got involved with health tech startups. I did my research and I saw the potential in that field. That's how I really got involved in it.
Okay. All right. So medical doctor working on a startup in healthcare industry. Is that a similar story for you, Dr. Mike?
Yeah, very similar. I'm a medical doctor, but I've been doing health IT for over 18 years. So I practiced about 3 years and then I went into health IT. And then I started as a project manager for EMR and hospital IT applications in different hospitals. And then about a few years back, I started my company. So our company is Med Projects. And then we work with hospitals implementing EMRs, electronic medical records.
All right, let's talk about that later. More about EMRs, what they are. So now I need to find out, Brian, how did you get into healthcare?
So to be honest, I ended up in healthcare pretty randomly. Actually, an economics student. Did my bachelor's abroad, but then I came into this by volunteering to help out in the pandemic. I knew programming and then sort of just applied it as a volunteer in helping the Red Cross set up a COVID-19 digital system. And from then, Dash Labs came about.
All right, we'll learn more about Dash Labs in a while. I know your story, Nigel, but tell our audience, how did you get into healthcare?
Right. So actually, similar to Kevin, my family, we founded two private hospitals here in Metro Manila. So even though I'm actually a computer engineering student, I was heavily involved with the business. I experienced firsthand the issues and the redundancies in operating a private hospital here in the Philippines. That's why we found, with Elle and my other co-founder Gab, we founded MedHyve to address some of these redundancies. But obviously, there's a lot more, and I think we'll be tackling that later.
Mhm. Okay, so you mentioned about these redundancies, inefficiencies in the system. I'm sure you guys have seen many other challenges and problems that need to be solved. That's why you're in this space, right? But so can I just go around the room and find out from everyone, what do you think are the probably top three biggest challenges in healthcare in the Philippines? And with that, what are the opportunities for innovators like everyone in this room? How can we help solve these challenges? So let's start with Brian.
So thanks for the question. I mean, it's I think really relevant. And what I see from my experience is that the top three challenges we face is the fragmentation of the space. Like there's not, like if you think about labs, which Dash Labs works with, there's so many labs around and not a cohesive aggregator. And this happens across many different kinds of services that, the diagnostic labs don't talk well to the hospitals, that don't talk well to the, let's say, healthcare or telehealth platforms. So one is fragmentation. The second is this is due to lack of infrastructure, which we're trying to build up. And number three is because of this, we lack good, clean data that we can use to make better decisions in. And with respect to opportunities, I think these three are good opportunities. Solving these problems would not only like be possible to build a business on, but it would be possible to improve the national healthcare ecosystem in the Philippines and the healthcare of individual patients.
Cool. You just mentioned it possible to build a business on, because that's actually what we're trying to ask. Is it worth building a business in healthcare, right? There's so many industries that startups can go into, but we're here. We're serving the healthcare industry. So Dr. Mike, what are your thoughts on this?
For the top three, I think Brian mentioned one of them, the fragmentation. So actually, you could actually feel it when you become a patient. But second one is you really have a lot of paper inside our hospitals. So you will feel the inefficiencies of paper. And then the third one is probably the siloed. So even if you have some automation, some digitization inside the hospitals, they are actually siloed. So you do not have integration, you do not have systems talking with each other. So those gaps, there are a lot of opportunities for addressing the problems within those space.
Right, thank you. And I think this would tag well with Nigel, because you're working with hospitals. MedHyve's also working with hospitals. Can you tell us what you think about these challenges and how startups can address them, Nigel?
Yeah, definitely fragmentation. That's one of the biggest ones. And actually, specifically, what we're trying to tackle right now is the access to medical supplies and medical equipment. Not just the access, but also guaranteeing that these private hospitals are getting safe and quality medical supplies, and also making sure that they're getting it at the right price. So that's specifically the problem we're trying to tackle. However, there are a lot more, especially when it comes to administration. There's a lot of expenses in running a hospital. That's one thing I learned. And yeah, I think that what we're tackling is just the tip of the iceberg, and there will be a lot more.
Right. So, Dr. Kevin, I think Xenia is slightly different. Is that correct? How are we? It's more wellness. Could you just tell us more about Xenia?
Sure. Actually, Xenia started with wellness, and it sort of embedded its logistics capabilities with wellness and sort of delivering care at home or wellness services at home. And then it sort of pivoted around 2 years ago, and that's where I came in the picture, wherein Xenia wanted to focus more on delivering health related services, particularly home-based laboratories, home-based testing, and it's everything is done and consolidated through a mobile platform, and then people can have the ease and convenience of accessing care remotely or at their convenience.
Okay, wonderful. You know what? Hearing from you, gentlemen, it's like we should we should s- jump on another call later and see how we can collaborate, because it's just like, okay, we should be talking to one another and making our industry even much better. So, um, can I just hear from you then? Because it's very different. We have one on labs, we have one on wellness, we have one on electronic medical records, and one on medical supplies procurement. How are you and your startups making a difference in your particular segments? Can you share some success stories on how your startups have impacted the hospitals, the clinics, the patients in general. So I guess let's start with Dr. Kevin, because since you were the last one to tell us about bringing healthcare to the home, that's basically something that Zen is doing, right? Okay.
Right. I think the biggest impact that Xenia was able to do is that it sort of contributed to preventing people from overcrowding the hospitals. So they would turn to services that we have, maybe for testing, for COVID testing especially, so that they would know if they have COVID or not, as well as sort of accessing general practitioners in terms of their continuity of care. When we had our lockdown, people had the problem accessing their physician, especially in the outpatient setup. So that's very much affected, and providing them ease of access to all these professionals and access to care definitely helped them maintain their good quality of life and their medical compliance.
Okay. All right. Brian, how did Dash Labs, help or impact, or any success stories that you would like to share to our audience?
Yeah, sure. So, I mean, Dash Labs, as I mentioned earlier, started as a volunteer effort with the Red Cross. So, we essentially powered the whole Red Cross COVID operations, which used to represent like 50% of the national's COVID testing, but now about I think 25% now. Success stories being able to digitize the whole operations and enable the Red Cross to scale and test the country. So, we helped the Red Cross get in the saliva test. And then deploy it all over the country so people can get an RT-PCR saliva test basically at their nearby chapters. So I'd say bottom line, we help ensure easy, affordable access to COVID-19 testing in the past 1.5 years through digitization of the laboratories.
Cool. Thanks for that. Nigel, how did MedHyve make a difference?
Yes. So actually, my example doesn't involve COVID, at least not yet. But I think if everyone remembers, I think during the start of 2020, there was this Taal eruption, and that caused a lot of dust clouds, especially in the south. So we worked with the Private Hospital Association of the Philippines in getting all these smaller hospitals in the south access to N95 face masks, and we were able to deliver the face masks at half the market price at that during the current time, and we were very proud of that. A lot of hospitals trusted us with trying to give them their essentials, and yeah, that's our story with this.
Yeah, thanks, Nigel. So, Doc Mike, any success stories that Med Projects has recently,
Yeah, we work with our
achieved?
clients in their journey towards paperless, as paperless as possible. So we go inside the hospitals. We try to digitize some of the things that are on paper. So even prior to the pandemic, we tried to digitize, for example, the lab results, discharge summaries, patient charts. Okay, so with the pandemic, there was this hesitancy to go inside hospitals. Okay, so suddenly the hospitals wanted patient portals. They wanted the patients to still be able to to have services inside, but then get their results outside. So for outpatient services, this was easy. So labs had this in place prior to the pandemic, but hospitals, they struggled with patient portals, digitizing all their internal activities. So we help with that. We actually created patient portals for our clients. Then we digitize some of the results and summaries, so that it's easy for the patients to just come in, have their results, tests, procedures done inside the hospital, and then they go home and then wait for it to be delivered to them via email, via portal. Yeah. So we try to digitize as much as possible inside the hospital.
Okay, one common theme that's happening here, obviously, is we all talk about digitalizing certain segments of healthcare provision, and I think that's one of the common denominator for startups. We are leveraging on technology. We're leveraging on the innovations and trying to impact our individual industry. So in our case, we are serving the healthcare industry. But also one thing about being a startup is that we should be able to collaborate and find win-win with partners, with different stakeholders. And so I guess my next question would be how has collaborations, you may be able to give some examples. How has this hastened your response as a startup to the pandemic? Because it wasn't easy. I'm sure it was never easy for anybody from the beginning of the pandemic until now. It's not easy, but collaboration somehow make things, move faster, better, more efficient. So can you think of any examples or any thoughts on how collaborations worked for you and your startup? So who would like to go first? I'm going to give you the option. Raise your hand. Anybody? Come on, guys. I don't want to arrow. Okay. Yes, Nigel.
Hi, yeah. So I'll go first. I guess for us, we collaborated with these associations of small hospitals and clinics, and because of the collaboration, it makes it easier for us to facilitate and try to get them the medical supplies at a faster time. And also, yeah, we also collaborate with our logistic partners, so we're now able to reach these private hospitals, even though they're in a very far away regions. And yeah. Uh, so I guess it's very essential for us in fulfilling the mission of our startup.
Right. So collaborating with associations to improve medical supplies procurement. I also know for a fact that there is a collaboration that we are having with
Yes.
Brian. Brian, why don't you talk to us about
Yeah.
this?
Yeah,
I'm
I
very
was just
proud of
about to
that
say.
too.
So yeah, so wait, two things first on the main questions you have. I'll collaborating. I agree with Nigel. Collaborating with the public sector helps a lot. So we also did this, with NGO, with the Red Cross, with the government to provide a better service to people and the public. And second is, as you said, with we're having a collaboration with MedHyve because again, as we're serving labs would always need medical supplies. So we're coming up with a way together to be able to provide medical supplies cheaper, more accessible to the laboratories that we serve. Thank you for that.
And thank you for that. See, so this is one prime example of startup to startup collaboration, and it's really it's never about. I believe that it's never about competition anymore because we are in a very collaborative, um, you know, process. So, yes, thanks for partnering with us. Looking forward to the next partnership with Med Projects and Zenia. But anyway, I need to add another question for our two doctors here. So, aside from your thoughts on collaborations, what do you think are the role of startups in the management of COVID? Management of COVID as a disease. So let's start with Zenya.
Right. So the role of startups, it actually depends on where the startup is. But if we're looking at the nature of a startup, it sort of looks at a pain point in a certain process, and sort of addresses that pain point, right? So, for example, with COVID, the biggest issue would be maybe accessibility to testing. May it be addressing the infodemic and all that. So a startup can actually be involved in any of these aspects. It's just a matter of how the startup would want to play that significant role. And I guess one of the crucial things, I guess that's important for a startup is that it sort of challenges the boundaries, which I really like when it comes to startups. We have such a, I guess, an old school traditional um, legislative component in our administration when it comes to healthcare delivery, and it's very old school. And now with startups coming in, it's sort of challenging those red tapes, pushing the boundaries, of course, with consideration to maintaining the health and quality standards that we aspire to have.
That's a very good point. Thank you so much, Doc Kevin. And in fact, that is also one of the battle cry for MedHigh because we're trying to, do away with fraud. Let's face it, it happens, right? We're trying to do away with the lack of data and visibility of information, and technology is helping us do that. Okay, Doc Mike, how about for your side?
Um, for the first one about collaboration, I admit that the past few years, we work with other vendors because inside the hospital you have a lot of vendors, but we haven't really collaborated with other startups. I think that's the COVID situation has really opened the eyes of a lot of companies. Um, so we look forward to collaborating with other startups, especially with the ones here. On the COVID situation, I have a lot of friends with DOH and with all the response that has happened. I even attended some IATF meetings. So it can be frustrating for those who are trying to solve specific problems, and you also see the problems when it comes to the end to end. Okay, so you have the testing. I think Brian could see the testing, but then when you submit it to COVID Kaya, for example, there's going to be a problem, and then getting those results. Even with the way that we handle the bed occupancy, I come from inside hospitals. I know how hard it is to get correct data in terms of bed occupancy rates. So when I see the numbers that are shown on TV about bed occupancy rates, I have some doubts about the correctness of it. Okay, so there are a lot of things with the COVID that has really come up, and I think there is really an opportunity for startups to just work together. But this is my end, this is your end. We can work seamlessly from this part until we get to that part. So I think that's the COVID and collaboration really it has highlighted this need for everyone to work together.
Right, right. And it would have been actually it would have been better if we have someone from public sector join the panel, but for future reference, we'll have that. We'll have that soon. So Doc Mike, you mentioned that one of the things you would have wanted to do is collaborate more. And I'm sure it's something that you will be doing now. But are there other experiences or things that you're looking back now, seeing how COVID panned out, and wish that you had done differently? Like, what would you have done differently looking back?
Um, I just wished I probably did some. I probably started earlier in some of the solutions that we did. I think that's one of the things because we were building a patient portal platform for hospitals. So that's one of the aspects that we had an EMR inside, but we were also building a patient portal. But when the pandemic came, our patient portal wasn't done yet. Okay, so we were trying to yeah. So there was
Timing.
this yeah. So a lot of the patient portals that we have right now are actually just a quick and dirty way to send out lab results. So it's just probably PDF, you can do it, but you want to have real advanced features like charting or even monitoring, like that one. But yeah, so I think if there was something that I wish that was done differently, I wish I started earlier on some of the solutions that we have.
That's a good takeaway. So for those of you who are watching us, for startup founder wannabes, I think you should start now. This is the best way because um, every industry has been touched by technology, by change, by the pandemic. So, this is the best time to start. And okay, just for the sake of our audience, can you just quickly tell them what is an EMR? We understand because we're in the industry, but perhaps maybe quick. What is an electronic medical record?
Okay. So inside the hospital, you have patient charts. Okay, so when you get admitted, you'll see this nurse going around with a paper, a folder, writing. So an electronic medical record is basically digitizing all of those from admission until ordering, until care plans, until discharge, until collaboration with multiple teams, different doctors looking at it, discharge planning, billing, everything. So that's it. So the electronic medical record is basically the computerized version of a patient chart. But that's an oversimplification, but still, it works as a
Right,
description.
right. Yeah. So, simply put, like for probably most of our audience, it's digitizing the patient records. Is that
Yeah,
correct to say? Okay.
correct.
So,
Yes.
Nigel, you are digitizing medical supplies procurement, right? How does it
Yes.
work for MedHyve?
So for MedHyve, well, actually, just to echo Dr. Mike's sentiment, there are a lot of paperwork, a lot of antiquated processes in the medical administration, hospital administration. So what we're doing is we're making that process much shorter. So a process that would take 2 to 4 weeks of canvassing, selection, it could now just take 7 days with MedHyve.
Okay, okay, thanks for explaining that. But I also want to ask you the same question that I asked Dr. Mike. Like, is there anything that you would have done differently, looking back on how COVID has changed everything with the past 2 years?
I think it would have been better for us if we collaborated with more partners because we started out very small. We started out with one association first. Yeah, and it grew from there. But maybe looking back, we could have been faster in that end.
Okay, why don't we ask Xenia if we can collaborate with them? Right, Doc Kevin? Can we
Yes,
start that?
that would be great.
Absolutely.
Okay, so all right, so let me throw that same question to you. What would you have done differently?
With the pandemic, the reason why I would say that I'm not going to change anything is because the pandemic brought about a lot of uncertainties. And being a startup, we should be very pliable and malleable when it comes to how we do our operations. So luckily enough, we're in that sphere that is in demand at that time. I guess some of the things that we could have done better is sort of um, improved I guess, our supply chains because we didn't expect the influx of demand, especially with regards to testing.
Right. Oh, testing. That's where Brian comes in. Anyway, but
Yeah.
okay, very quickly as well, could you tell our audience what do you do at Xenia? Like, how do you impact a patient like me?
Right. So actually, for just a brief introduction more, back in med school, I actually started a startup. That's why I got involved in a startup, and it focuses on what Dr. Mike's specialty is, EHRs. So I wanted to create a more, I guess, robust EHR platform that would benefit the public. So what I do in Xenia is that I sort of translate the medical knowledge and medical know-how that I gathered, especially with my background in creating the medical records back then, and sort of help them translate it into a more, I guess, a language where programmers can actually easily understand it, and they could translate it into a certain product or a certain feature in the app. Also, I'm also playing a big role when it comes to making sure that we're up to par with regulatory standards, that we're applying the best practices. And then, of course, we want to equip our, our providers with the tools necessary to be able to guide them in how they do and deliver care. So pretty much it's more of that oversight.
Okay, when you say tools, what exactly are these tools that
Yeah. For example,
yeah.
yeah, a big example of a tool is you know how when you go to a patient and you do a step-by-step process of vaccination, right? Sometimes we want to make sure that the steps are being followed. So in the app, we have a feature wherein the nurse would know how to follow step one, step two. She's going to be able to double check. She's going to be able to put in what time the vaccine was delivered, what location the vaccine was delivered, and of course what side effect might manifest if there's any side effect there, and that goes towards a record, a database. So things like that, little tools like that actually help ensure that we have that quality of care maintained. Another tool that I want to share, and we're very proud of this, is our cold chain capability. So we do use medical devices, IoT devices, that sets off an alarm at our headquarters whenever there's any fluctuations with our fridge, whenever there's fluctuations with the kits that we bring that's bringing the vaccines. So we were able to maintain that cold chain at that level of quality.
Wow, very interesting. And to our audience, things like vaccine are very temperature sensitive, so they need to be very monitored very well. So, Brian, is it similar in Dash Labs? Do you also have an app?
So we're actually purely a web app right now, and we're focusing all of our efforts to building the web app as it is the most accessible device to use. But yeah, the challenges are similar, and sort of the solutions are similar. We're trying to build a system to ensure that everybody has the highest quality care in an easy way and getting rid of paper as well. Going back to your early question of something that we wish we had done differently, when we were initially building the product, we would sometimes as software engineers like build something because that's the way we thought things were done. This was the assignment of results, for example, where the medtechs would have to assign if someone's, or at least the pathologist and medtechs would assign if someone is positive or negative on the platform, and we had configured it to do it specifically person by person. But if we had just talked to the medtechs, they would have preferred another format, which is a grid format, to see the whole batch at once. So the lesson for us was, like really talk to your users first and build something that your users want to have, and something that will make life easier for your users.
Yeah, and I think this is also one of the strengths of startups. We should be, very agile. We should be moving very fast. We should be watching trends. So I'm not going to take away the mic from you, Brian, because so that was something that you wished you had done differently. But are you thinking about things that you wish the startup community are doing with you? Like what is one thing that we should all be doing?
I think it's, I guess, the main topic of this discussion, kind of collaboration. Things are very fragmented. It's a big problem, and one easy or at least faster way to get through that fragmentation is for us to collaborate with each other. Like, for example, now with MedHyve, with Nigel, we now have an ability to give labs access to a marketplace where they can order medical supplies from instead of having the trouble of going to their individual suppliers one by one. It also makes things easier for medical workers and who are the people we really want to serve.
All right, collaborate. Okay, so Nigel, what is something that you wish everyone is doing right now, and why?
Well, actually, it's just a form of collaboration, and I think Brian mentioned this already. But definitely trying to get to know your customers. So especially the doctors, making sure that what you're building is what the industry needs right now, and I think that's the number one thing. I think it's the golden rule in startup is don't assume anything. Just test it on your users, and yeah.
All right. Thanks for that, Dr. Mike. What do you think?
Um,
What do you wish everyone is doing?
if I had a wish for the startup community, I wish that they knew the domain better in terms of healthcare. I feel that the Philippine startup community has really ignored healthcare in a way. The startup, along with the companies and investors, because there are easy startups, are easy solutions like a practice EMR. Okay, so that's the easiest to find. But then you have these um, problems that are internal to a specific domain. For example, the supply chain. That's something that not everyone is exposed to. What we do inside the hospitals. Okay, what happens inside the labs? What happens to the care anywhere concept? Okay, that Zenia is doing. These are things that are really just they are close to our hearts in a sense because we are in it. But the other people in the startup community, the other companies, the investors, they don't see it as a. I wish that they just knew the domain better. They just did some more research. What are the real problems? Why are we having problems with our testing? Why are we having problems with accuracy of results? Why are we having problems with patients that need to go doesn't want to go in? Okay, so there are things that are not easily solved by just having a small EMR that's on a blockchain something. Okay, so yeah, I wish that's my wish for the other startups or startup community.
Understand, and I hear you. Even in I think in the investor community, one thing that you can observe is that there are very few who have domain knowledge in healthcare. There's a lot of money out there, but not a lot of them understand healthcare that deeply. And healthcare is not an easy industry to be in, right? Because we're talking about lives, we're talking about families. So yes, agree. We should all be learning more. That's why I guess that's the reason why we come together in platforms like this to learn from one another and to learn from medical doctors like you and Kevin. So,
Yeah.
so Dr. Kevin, is there anything that you wish that everyone else is doing
Yeah,
together with
actually,
Xenia.
I like Doc Mike's answer to that, because most startups actually they look at healthcare in a microscopic lens. Look at a particular issue and then they would try to solve it just with that. For example, just EMR, focusing on EMR. But there's so much component to it, and there's so much players in the healthcare ecosystem that they should consider how is it going to benefit the doctor, how is it going to benefit the patient, the facilities and the other stakeholders. If there's anything that I would encourage people to do, it's sort of to step up and challenge some of these gaps and consider it from a more macro perspective. I guess this is a good time to share to everyone. We actually launched a Philippine Digital Medicine Society just this year, and the goal is actually to sort of create a movement towards the adoption of health tech, and of course, create a unified direction towards the development of these technologies. There's so much advantage when it comes to getting a lot of, especially information. In medicine, it's information driven. We all practice evidence-based medicine. And of course, if we're able to gather these information from different stakeholders and consolidate it to maybe a one unified unit in the future, then that's something that we can look forward to. That's going to be very exciting.
Oh, congratulations on the Philippine Digital Medicine Society. Is it called Society? Okay.
That's right.
Okay. Congratulations. Do
Thank
tell
you.
us more about that even after the panel
Mhm.
discussion.
Of course.
Okay, so we've been talking about all of the things that you have learned and would have wanted to change, and then we move to what you all wish everyone is doing more of. But I think we actually highlighted the fact that healthcare, as Doc Mike pointed out, the domain knowledge for this industry is not easy to acquire. It takes years of immersing yourself in the industry and understanding the different stakeholders. So, okay, I'm going to do a very quick round, and this is going to be controversial. Is it worth building your startup and your business in healthcare? Can you really build a business in healthcare? What do you think, Nigel?
Yes, so many
Yes.
opportunities, so many problems. This is what the country needs right now. This is what the industry needs right now. More, more innovators out there come in. Please help the country. We're
Help.
also helping the Filipino people.
Okay, Brian, do you feel the same? Is it worth building a
Yes, I
business
do.
in healthcare? Okay.
I do. Essentially, I want to say, or I want to add that, you know, there's so much innovation in fintech going on, and healthcare is still a bit stuck in the 20th century. So it's high
Exactly.
time we bring healthcare to the 21st century.
Cool. Yes, healthcare 4.0, 5.0. Doc Mike, is it worth building a business in healthcare?
Yes, definitely. Um, I also feel that the Philippines has a very nice position in terms of Southeast Asia, not only for the startups, but in terms of the healthcare. So because of our English, our capability to do solutions, it actually expand and uh, build solutions that are also for other countries. So yeah, health IT is a very nice
So
area
it's
to
still a
build
go.
solutions.
Yes.
Yeah.
Doc Kevin, do you think it's, with all the difficulties and strangeness of the industry, is it worth
Right.
building a business in
Of
healthcare?
course, healthcare is a basic human right, and it's here to stay. And everyone of course, would want to have a good, healthier lifestyle in the long run. So there's always
Right.
opportunity.
So I guess that, it answers the question of the theme of this community event for Philippine Startup Week. But then I'm going to just make another round to our panelists, because now that you're saying that it's, healthcare is an industry that startups should also look into and, learn from and learn about before they just jump in it. What is one practical advice that you would want to leave our audience, because our audience is a mixture of, investors, academics, government, and startups. So you could be talking to someone who is thinking about, starting something innovative but quite, unsure. So what would be your advice? um yeah, Doc Mike, I'm going to start with you, not because we are, more wise and aged, but because, yes, you have more
Okay.
experience. Let us
Okay.
know.
Yeah. If there's an advice I'd give to, I think it's I want the startups who want to go into healthcare to fall in love with the problem, not with the solution, because a lot of times tech people will have solutions in mind. They already have this. I will bring this to this one. I will bring this. Uh, but when you go inside and see the problem, sometimes the very basic technology can actually solve some of the problems. Doesn't have to be the high end technology. Then you'll find a lot of opportunities as you go and expand those basic. Yeah. So yeah,
That's
that's
very
it. I
deep.
think that's my advice. Please
And it
fall in
seems
love with the
very,
problem when you go inside. Have an open mind. Fall in love with the problem when you work with the doctors, the nurses, the clinicians, the patients, and then yeah,
yes.
work on that one.
Yes, because some may believe that everything can be solved by technology. That is not accurate, right? Technology is an enabler. So you have to look at it that way. You cannot say I'm going to solve everything with technology if you do not
Yes.
have an understanding, as you said, of the users. And there are many users. It's not just one kind of user. So that's a very good advice. So from one doctor to another, let's hear from Dr. Kevin.
If there's one advice I would give, it's to be open and talk about it. Usually, the problems of founders is that they want to keep ideas to themselves, but ideas are meant to be shared. It's when people are actually talking about a certain idea, that's when an idea would grow. It will sort of add into it. And of course, if you did your research and you're very comfortable in diving in to doing a certain endeavor in healthcare, then as long as you did your due diligence, you can jump in. Don't be afraid, commit to it, and stick by it, of course.
Right. So talk to others about your idea. I think they could start with the Philippine Digital Medicine
You could
Society,
say.
right? See, shameless plug. Okay. Yes. Brian, any practical advice to our startup wannabes or those already in the healthcare startup sector?
Yes, of course. I maybe go back to when we built out what Dash Labs is right now. We weren't looking to build a laboratory information system. What happened was when we had the problem of helping the Red Cross, we first looked at encoding, like the problem of encoding data, the problem of sending results, and the problem of the lab process. And then we found out after that that, hey, we have something like a lab information system. That's pretty cool. So like the focus is, or focus on the next biggest problem you have, solve that, and then look at the next biggest problem that you have, and just keep on doing that.
Cool. Yes. Do not try to achieve everything all at once. It's gonna what do you call this? It's going to do some problems with your mental health if you do that. Anyway, so Nigel, any practical advice to
Yep.
our audience?
Uh, so don't be intimidated. I'm 23. I've never been to med school. I deal with doctors, administrators that have been doing, in the field longer than I've been alive. Uh, because as a startup founder, it's your job to bring in a fresh perspective, to bring in new ideas, to help them execute what they need to do, and that is to help the Filipino people. And, yeah.
All right, thank you so much. You know what? Why don't we close this panel with just your, I'll call it a shameless plug. Tell us about your startups. Tell us how to contact you. Tell us who you're looking for. So, Nigel, I will start with you.
We're MedHyve. We're a medical procurement platform. So we help hospitals and clinics and other medical institutions to access and to find the right medical supplies. You can contact us at hello@medhive.com. You can email us. Or, yeah. I think.
And we are looking to serve hospitals, clinics, and as well as medical supplies vendors, pharma. So these are the type of profiles who we can help. Right. Okay. Let's go to Dr. Kevin. Tell us more about Zenya and who are you looking to serve?
Yep. So we are Xenia. We're a digital-based platform that focuses on delivering medical care services anywhere, pretty much at the comfort of your own home. Our target market would be generally the public or some organizations that require a platform that they would be able to access care and provide care to their employees. It's also another market for us, and you'll be able to contact us at zenya.com. Thank you.
Cool. That's Zenya for you. Brian, tell us about Dash Labs.
So, hi, we're Dash Labs. We digitize medical diagnostic laboratories. We aim to help labs get rid of paper and help med techs and laboratory workers have an easier time in getting results to patients accurately and faster. You can contact us at brian@dashlabs.ai. So just send me a mail.
Thanks, Brian. Thanks for that. And now tell us about Med Projects, Doc Mike.
Hello, our company is Med Projects. We are a healthcare IT consulting and software development company. We build better software for hospitals like HIS, EMR. So we are looking for hospital clients and possible investors. You can reach us at team@medprojects.com. Thank you.
Wonderful. So we would like to thank everyone. That brings a close to our panel discussion. We know you're all very busy. You're all running your startups and running your team, finding investors, looking to grow. And thank you for joining us this evening on day one of the Philippine Startup Week. We're actually under the track called Collaborate, and this is something that has been running around back and forth because I think what we're trying to say really is in this industry, we need to find people to collaborate with because there's so many problems, there's so many gaps, and innovators like startups like us, everyone you see on this picture, are there to solve it. It really empowers the industry. It also gives a place for innovators, forward thinkers, to help solve these problems. So once again, I would like to thank the panelists who joined me this afternoon. There's Nigel Lirio from MedHyve. Thank you. Dr. Kevin Dineros from Zenya, Brian Geiger from Dash Labs, and Dr. Mike Moen from Med Projects. This has been your host. My name is El Kwan, co-founder of MedHyve, and we thank you for joining us for this community event. Continue to enjoy the rest of the Philippine Startup Week. We would like to greet everyone good evening and God bless.